Transcatheter aortic valve implantation is a keyhole procedure to replace an aortic valve. The standard technique for valve replacement is open heart surgery, where the heart is stopped, the chest is opened, the valve is removed, and a new valve implanted. The keyhole technique, by contrast, does not involve stopping the heart or opening the chest, but the new valve is implanted via a tube in the leg. The patient is awake. The procedure is carried out usually under sedation, and the whole procedure takes between an hour and an hour and a half. And a new valve is implanted inside the old one. A wire is passed across the valve, and a balloon-mounted or self-expanding device is placed inside the old valve. So it's a replacement valve without the need for anesthesia and open heart surgery. So the alternative to TAVI is open heart surgery, where the heart is stopped and the valve is replaced. And that's a well-established conventional technique which has been available for around 60 years. By contrast, TAVI has only been available for around the last 20 years, but is extremely successful, as being used in a large number of patients who previously would have had to undergo open heart surgery. Well, the major benefit is that it's a much less invasive procedure. It does not involve open heart surgery, general anesthesia, and the need for a bypass heart-lung machine. The procedure is carried out under local anesthetic and light sedation, so the patient is awake. The recovery period is much, much quicker. So rather than staying a week in hospital, which would be the standard approach, one is home after 1 or 2 days. And the standard recovery period after open surgery is around 6 to 8 weeks, whereas after TAVI, it's usually in the order of 1 to 2 weeks. So a much quicker procedure, a much better tolerated procedure, and a very effective treatment for a patient with a severely narrowed aortic valve. TAVI is an extremely successful procedure and is so successful it's overtaking conventional operations now in terms of numbers across the UK, Europe, and the USA. It's a very quick, straightforward treatment for a severely narrowed aortic valve and offers the benefits of a rapid recovery and early immobilization. TAVI is not generally used in younger patients, particularly those who would have a metal rather than PIGS valve implanted. And also there are a number of anatomical features which make TAVI less attractive. So for example, if there's lots of calcification around the valve, or there is disease in the arteries leading to the heart and we're unable to implant the tube, one might think about using a conventional operation rather than TAVI. But in reality, the number of these patients in whom TAVI is inappropriate is shrinking, and we'll see over the next 10 years an increase in the volumes of patients being treated with this particular technology.